Afternoon, Barry. How are you going?
Oh, good afternoon. How?
I'm good. And are you comfortable where you are?
Yes.
Pillows okay?
Yes, a little bit.
All right, lovely. Now, we've had a little bit of a look at your gait, and one of the things that we noticed when you're walking is that when you're walking, your heel's not always going right down onto the ground, especially with your right leg.
Yeah.
So what I'd like to do is have a little look and see what kind of things could be contributing to that.
Yeah.
Okay. So the first thing I'm going to do is just get you to pull your toes right back for me as far as you can. So leaving your legs flat on the ground for me. That's it. Pulling your toes back. Can you point your toes down to the floor for me? All the way down. Very good. Now this time, I want you to bring your toes up towards your head as hard as you can. Don't let me move you. Don't let me move your feet. Wonderful. And this time, pushing your toes right down to the ground into my hands. Wonderful. Good. Okay. Now, just there, I was just testing the strength to see how the strength is in your ankles there. The next thing I'm just going to have a look at is the range of movement you've got in your ankle here.
Yeah.
Okay, so again, I'm just going to get you to pull your toes up towards your head. That's it. And just comparing that to the other side there. And that's it, and pointing your toes back down to the ground for me. All right. Now, I'm just going to pop this roll under your knee. Okay. And it's just under the one leg at the moment. And I'll get you to pull your ankle back for me as far as you can. Just leave your heel on the bed for me and pull your ankle back and back down to the ground. Point your toes down. Okay. And I'm going to swap it over to your other leg. Okay, and again, toes up towards your head. Good. And pointing your toes down. Well done. Okay. Now, this time I'm going to have a bit of a look at the sensation in your legs. So, can you feel this? Can you feel me touching you there?
Yeah, just. Yeah.
On that side?
Yeah.
And down here?
Yeah. Just.
Okay. So, I'm going to get you to close your eyes for me. And when you feel me touch you, I want you to say yes. Okay? So, closing your eyes for me.
Left. Left. Left ankle. Left bottom. Other one. Right.
So just say yes or no, Barry.
No.
If you feel me.
Yes. 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 Yes.
Okay. Thank you. You can open your eyes now. Actually, no, I don't need that one. Okay, so the next thing I'm going to test is just to see whether you know where your ankle is moving in space. So what I'm going to do is I'm going to position your left foot in a position, and I want you to try and match it up with your other foot. Okay?
Yeah.
So for example, if I am bringing your foot back, just relax for me. Yep. So let me move your foot for you, and I want to see if you can match the same thing with your other leg. You can match the same movement. Oh, it's all right, I don't have a roll for both. Okay. So closing your eyes for me and matching it up for me. Okay, just relax for me on this leg. Okay, great. Now, the last thing I'd like you to do, you can open your eyes now. I'll get you to sit up onto the edge of the bed for me, and I'm just going to test your reflexes in your legs, okay?
Okay.
All right. Okay. All right, Barry, so the next thing I'm going to do is I'm just going to have a look at how your muscles are contracting and relaxing. So I'm just going to do a quick movement with your ankle to see how we go, all right?
All right.
So when you're ready, so just relaxing your ankle for me. Comfortable? It's all right?
Yes. Yeah.
Okay. And just on the other side, just relaxing this foot for me. Okay. All right. Now I can get you to sit up onto the edge of the bed for me. Right to go, Dave.
What's it, a drumstick?
So I'm just going to test the reflexes in your leg here.
Yes.
Okay. So I'm just going to do one up here for me. Might jump your leg a little bit.
Yes.
Okay. Doesn't hurt at all?
No, it doesn't hurt. No.
Okay, good. Now, just going to come around this side for me.
Whenever you're ready.
Okay. Just on the other side here. All right. Okay, well thank you for that, Barry. I'm just going to have a bit of a discussion about what I've found from the assessment, and then we'll get on to some treatment options for you.
Okay.
Okay,
Very
thank
good.
you.
When you assessed Barry's power.
Yes.
Because I think his foot really came up in quite a degree of inversion. And let's have a look and see
Okay.
what's going on with the power. Do
Yep.
you mind, Barry, do you mind lying back down
No.
again? Would that be all right? Okay, can you lie yourself back down on the bed?
Well, that's right, we shuffled a bit down,
Yeah.
didn't we?
You're right. Okay, you get comfy.
Your neck okay there?
That's okay.
All right, great. So just come back again and have a look at that again. So show me how you assess the power.
Yep, okay, so Barry, I'll get you to bring your toes up towards your head for me as much as you can. Yeah, and point them back down to the ground for me. Good. And this time I want you to bring your toes back up towards your head, but I'm going to I want you to resist. That's it. Yep, good. And back down to the ground for me. Point your toes down to the ground, into my hands. That's it. Well done.
Yeah.
Okay.
Okay, so one of the things you noticed about his gait was the rotation of his hip, wasn't
Yes.
it? So partly
So,
his
yeah,
foot's
his foot.
falling out because of that. But if you look at how his foot's coming up, especially when you had resisted, he's really coming up like that,
okay.
isn't he? So what
Yeah.
muscles is he more using to do that?
Tibant.
Yeah.
Yep.
Okay, so let's bring we roll your kneecap up a little bit. There's a lot of, it's difficult for you to do, isn't it? Yeah. Let's just see if we can reposition your foot like that so we can see a little bit more what's going on here. Okay, I want you to look and see the activity going on here. Bring your toes up for me again, just the same, bring them up, just the same as what you did before. You see that?
Yep.
Yeah, and you
So
can see
good.
how
Yeah.
there isn't quite so much going on there.
Digitorum, yeah.
Yeah, and probably because you, of the position where you were assessing, if you sit down on the stool and have a look, that's it. Bring them up again. Can you see what I could see before with the medial border coming up
Yep.
more than the lateral border?
Yep.
So there might be problems with power.
Sure. Okay.
Yeah.
Yep.